Can you tell us a little bit about, okay, after the patient comes in with taking drug X, they're feeling better, do you continue the medication, or do the patients even come in? Is adherence an issue? And obviously, a lot of these biologics are IV therapy. What are some of the quality of life issues?
Well, with biologics, it's easier in a sense that to come in for an IV like Remicade, they're getting directly observed therapy. So if you're infusing them in your practice, you know if they don't come. And presumably your nurse or nurse practitioner tells you they didn't come today. If they're in an outpatient infusion center outside of your institution or your office, most of the time they're going to tell you the patient didn't come for their appointment. So it is, in a way, it's easier. With pills and injections, you don't get that. And in patients with chronic ulcerative colitis, the non-adherence rate is 50%. And the problem is that these patients in general are young, for the most part. The average age of our patient, our practice, is about 40, and most patients are diagnosed in their 20s and 30s. That's not an age where people expect to have a chronic illness where they're going to need to take medications for the rest of their life. They're busy, they're employed, they're having kids. Sometimes they're single men who are the worst sort of patients as far as taking pills. So adherence is definitely an issue. And the problem is that if you don't take your meds, the flare rate is 5 to 6 times higher than if you do. And there's a cost consequence of that. Actually, patients that don't take their medicines cost more to the healthcare system than those that do. So what I do when I see a patient back in the office is I'll just give them the statistics and say, listen, this is a chronic illness. If you want to prevent a flare, you need to take these medicines on a daily basis, and if you do that, your chances of flaring are only 10 or 15% a year. You have to give them, they have to know the consequences of their action. The other thing as a physician you can do to help them is you can make it a little easier to take their meds. So there's some newer formulations of some of the pills that decrease the pill burden so they can take less. Almost all of the aminosalicylates you can give once a day as opposed to divided up twice and 3 times a day, which is what was done traditionally in the past. So once a day, less pills, you make it easier for them. Those that have trouble remembering, you can try to trigger it with some other activities, like, what time do you brush your teeth? Is it morning, night, or both? You can put your pill bottle by your toothbrush as it gives a visual cue to take your medicine. So we try to help them with that.